male vagina.
Thank you so much for the lovely introduction. Good morning. So I want to talk about this case due to the fact that disorders of the reproductive tract in captive birds are amongst the most common reasons for seeking veterinary care for owners that have captive birds. Additionally, although reproductive disorders such as chronic egg laying, oviductal disease, ovarian disease, and testicular tumors are very easily diagnosed in our avian patients, the treatment of these disorders still remains very challenging for practitioners. Thus, I've chosen to talk about testicular neoplasm associated polyostotic hyperostosis in a male budgie. The patient was a 4-year-old intact male budgie who presented with a complaint of dyspnea and a salomic mass. The patient was noted to have a chronic history of mild respiratory distress that had worsened over the past several days, according to the owner. The respiratory distress was presenting as an increased respiratory effort, as well as tail bobbing and a reluctance to eat. On presentation, the patient was in fact dyspneic with a heart rate of 400, a respiratory rate of 140, and a body condition score of a 4 out of 9. The dyspnea manifested as an increased respiratory effort, as well as the tail bobbing that was described by the owner. And he also did show a reluctance to move, as well as a reluctance to eat with a very poor appetite. The most interesting finding on physical exam was the salomic mass that was very palpable, as well as indicated by the black arrow on the photo to the right, a change in cere color. For those of you unfamiliar, male budgies commonly have a blue-colored cere when they are a mature male. In this image here, you can see that the cere is in fact fading from a blue color to a more pronounced brown color. The brown cere is very typical for a mature female bird of this age and species, thus indicating a possible hormonal change in our patient. Before we pursued diagnostics, we first thought it was important to, of course, stabilize our patient. So we went with a supportive care that was pretty broad spectrum for the respiratory distress that he was experiencing. This included oxygen therapy, anti-inflammatories, antibiotics, and antifungals. The first step for our diagnostic plan was full-body radiographs. On full-body radiographs, we had a few very interesting findings. I first want to draw your attention to the solid white arrow in both images. The solid white arrow is showing you a dorsal solitary salomic mass adjacent to the left kidney. The mass was approximately 1.3 by 1 centimeters and was round and soft tissue opacity and had a cranial convex border. Additionally, which is indicated by the dashed arrow but is present in all of the long bones, is a sign of polyostotic medullary hyperostosis of the long bones. Polyostotic medullary hyperostosis on radiograph presents as an increased opacity of the bones. It is important to note that in avian species, the bones are typically hollow since they are pneumatic bones. However, it's evident in these radiographs that the bone is pretty solid and has a very increased opacity at the medullary cavity. Additionally, we found an increased pulmonary and air sac opacity, which is shown throughout the thoracic cavity of the bird. Because of these findings and literature that supported the link between polyostotic hyperostosis, a change in cere color, as well as the salomic mass, we chose to go after the differential of a testicular neoplasia first. So what is this link? I first wanted to describe what polyostotic hyperostosis is. Polyostotic hyperostosis is common in reproductive active females due to estrogen presence. In males, however, it's very suggestive of a paraneoplastic estrogen production and is commonly associated with Sertoli cell or sex cord stromal tumors. The link between medullary bone formation and estrogen is due to the ovarian follicle in females. So I first wanted to discuss that pathway and then describe how it is linked to our male budgie. Medullary bone formation happens alongside the maturation of a preovulation ovarian follicle. And this connection is regulated by the hypothalamic pituitary ovarian axis. Before ovulation, LH from the anterior pituitary binds to the receptors in the theca externa layer of the follicle. And this triggers estrogen production. The estrogen then binds to the receptors in the osteoblast nuclei, and this leads to an increased production of osteoblasts depositing the type 1 collagen necessary to fill medullary bone, as well as other organic compounds. In males, this is important to know this pathway due to the fact that the testicular tumor is leading to the increase in estrogen production, which then leads to the increase in type 1 collagen as well as organic compounds being deposited in the medullary bone, which then leads to our secondary medullary bone formation. In male budgies, this has been shown to be linked to this testicular tumor as well as the other clinical signs that we are seeing in this bird. Because of this link that has been found in literature, we chose to go after the testicular neoplasm as being our main source of the other clinical signs in the bird. And the owner elected to first go through medical management due to the financial treatment plan that she would like to pursue. The medical management for this bird was indicative of a desirelin implant, or a GnRH agonist, and was first attempted. However, within 2 weeks of having the desirelin implant, the bird showed no improvement in its clinical signs. For this reason, the bird was re-presented to the emergency service for emergency exploration of the tumor and hopeful excision. Upon surgical exploration, it was confirmed that this was a testicular mass, and there was significant evidence of invasion throughout the salomic cavity. Unfortunately, the patient did go through intraoperative arrest and was unable to be resuscitated. However, we were able to do postmortem histopath, and it was confirmed that it was a metastatic sex cord tumor. I now wanted to walk you through our different treatments that we did pursue. First, focusing on the desirelin implant. The reproductive physiology in birds, as in mammals, is under the control of the hypothalamic pituitary gonadal axis, also known as the HPG axis. Gonadotropin-releasing hormone, or GnRH, is a peptide hormone that acts as the main link between the neuronal and endocrine systems. And this is what's controlling reproduction in birds as well as in mammals. So how are we using the desirelin implant to manipulate this pathway? Desirelin is a GnRH agonist and is commonly clinically used in birds to suppress reproductive behaviors or treat hormonally driven neoplasias. The efficacy, however, does vary depending on the species of bird due to the interspecies differences, as well as the tumor stage and type, which is important to put in our back pocket as I work through how this desirelin implant works. So let's work through how the desirelin implant is going to manipulate this tumor. The desirelin implant works in 2 phases. The first phase is an initial phase of stimulation, with the second phase being a chronic phase of downregulation. The initial phase is when it binds to GnRH receptors in the anterior pituitary, and this causes a transient increase in LH and FSH secretion. Although this may temporarily stimulate gonadal activity and increase the size of the tumor, it has a secondary phase of downregulation. The secondary phase of downregulation is caused by the continuous exposure of the receptors in the anterior pituitary to the GnRH. This is in contrast to the typical pulsatile exposure of those receptors to GnRH. Following this continuous exposure, it results in a decrease in LH and FSH secretion, which transiently leads to the suppression of gonadal steroidogenesis. The suppression in gonadal steroidogenesis then leads to reduced size and activity in hormonally responsive tumors. And this has been shown to be very effective in certain species of birds in reducing and suppressing gonadal activity, with the average duration of a 4.7 milligram implant, which is what we used in this bird, being approximately 3 months. So with the goal being to reduce the estrogen levels and limit the perineoplastic effects, what are the limitations in this case? So some limitations, as I touched on briefly, is that it has interspecies differences. The interspecies differences are important to note because avian species have 3 different types of GnRH receptors. They have avian GnRH 1, 2, and 3. This is in contrast to our mammalian species. Because of this, it has variable efficacy and is quite unknown whether or not using mammalian GnRH agonists such as suprelin or desirelin have variable efficacy in birds and different reaction to these receptors. So that is one limitation that I wanted to touch on. Additionally, because the tumor was poorly differentiated and likely hormonally autonomous, there is variable response time for this tumor to doing medical management, which was something that we did go over with the owner. Additionally, due to the advanced metastatic disease and seeing the other signs, as well as the thoracic cavity increase in opacification, It may have also decreased the likelihood of response to the therapy. So I want to now walk you through our postmortem histopath. So to orient you with the video on the right-hand side of the screen, this is a sample from the testicular mass. I am then moving forward to zoom in on the peripheral extent of this tissue sample to show you the remnant renal tubules and glomeruli that were present. This is indicative of renal involvement and also supports our claim that it had invaded the coelomic cavity. Something else important to note with this sample is that there was no normal testicular tissue identified in this sample, which was also very intriguing, thus supporting our claim that this was in fact an aggressive, infiltrative sex-cord stromal tumor, since the features were not consistent with a primary renal tumor, however more consistent, showing, and I'll get to on the next slide, a sex-cord stromal tumor with renal involvement. This is further in our histopath on one of the slides, zoomed in, just to demonstrate the rosette, which is circled on the slide on the right-hand side, which is a histological feature that is also suggestive of a germ cell tumor. Since our histological features were suggestive of a germ cell or a stromal cell tumor, I wanted to go forward and explain why this is important, what the key points are to take away from this case. Testicular neoplasms in birds can mimic female hormonal syndromes and can show sexual behavior that are similar to birds, as well as present themselves as more female and presenting. Additionally, respiratory signs can be the only presenting sign of a reproductive neoplasia and is important to have on a differential list when seeing a bird in respiratory distress. Because of this, it is important to do early diagnostic imaging to help us to identify testicular neoplasms or reproductive neoplasms in general at an early rate to be able to do surgical planning, with polyostotic hyperostosis being a very important radiographic clue. So what does this mean for overall clinical relevance? Reproductive neoplasms, as I said, should be considered for dyspneic male birds. And it's important to recognize because although multiple case reports and retrospective studies exist on this topic of using desirelin implants in certain bird species, there are not very many prospective controlled studies on the efficacy and safety of desirelin implants to date performed in captive avian species. However, they are performed in production species such as female chickens. Because of this, it's important to recognize as practitioners that hormonal therapies such as desirelin have variable efficacy in birds due to the interspecies differences, and serves as a very difficult conversation when having with owners due to the fact that we don't have enough research to be able to confidently say in our conversation whether medical or surgical management have a better prognostic outcome when dealing with testicular neoplasms in birds. At this time, I'd like to open it for questions and comments, and I truly do thank you for your time.
Does anybody have questions for Alyssa? Oh. The next speaker would go ahead and start migrating toward the front. That would help.
Hi, how are you? First of all, I wanted to say that it's a very interesting presentation. I have a maybe it's very basic, but how do you put an implant in a bird?
Yeah.
I have no idea.
That's a great question.
What kind of implant is that?
Mm-hmm. So you have a few options. So the two surgical options that people typically pursue is both subcutaneous approaches. The first option is between the scapular region of the bird, so along the dorsum. The other option is actually in the thigh of the bird, and both of them are placed subcutaneously. So it's really simple. You just make a small incision with a scalpel blade, insert the desirelin implant at a parallel angle to the bird's muscle to ensure that it doesn't go intramuscular. And then you just do two simple continuous sutures to close the incision. The two options that we do have for these implants is we choose to do a long-acting agonist, such as a desirelin or suprelin. We typically do not use the short-acting due to the fact that it has variable efficacy in the bird species. We elected to use desirelin acetate due to the fact that literature had shown in chickens to have a 3-month effect, versus the suprelin only having a 1-month effect in the prolonging of egg laying in female chicken species. Because it's also cheaper to not use a name brand desirelin acetate. So we elected to use the desirelin acetate mainly for the financial expense of the owner, as well as the prolonged 3-month activation, and then also chose to do a thigh approach. approach on this bird. So we went in at the thigh, which I do have. I can get out of the presenter view for you. I can show you. This is where the implant sat. So this is from the thigh approach, so the orange is actually outlining our implant here on radiograph. So this is post-implant of the implant itself. And this is about 1.5 weeks post-Deserelin implant with no obvious change to the size and the mass or clinical signs in the bird.
Thank you.
Yeah, of course.
Thank you, Alyssa. Let's thank Alyssa and move on to our.
Thank you so much.